Hi, I'm Brandon Leonard. I'm with Men's Health Network, and I'm here in Washington, D.C. at the Dialogue on Men's Health series, discussing initiatives and strategies to improve men's and boys' health across the lifespan. And I'm speaking today with Darryl Davidson, who is the Men's Health Manager for the City of Milwaukee Department of Health. So welcome, Darryl.
Thank you, Brandon. I'm glad to be here.
Could you start out by telling me what is unique about your men's health program in Milwaukee?
Well, the Men's Health Program in Milwaukee was developed not just through the Public Health Department, but also through the questions and surveys that we gave to men in the city. We specifically are addressing the health care concerns of men age 14 through their adult years, and we cover a lot of areas related to the fundamental principles in public health. So we do address policies related to men's health. We also address assurance that men will receive the types of services that they desire and that they need in not only health services settings, but also in addressing their goals and other things that they might believe influence their health. So for example, where we exist in the city of Milwaukee, we have health centers with our men's health offices. There's 3 of them. They're located on bus lines for those individuals who are low income or do not have access to transportation. We also have a public health nursing model, which means that the individuals who come to our clinics are going to seek help from the public health nurse, receive an evaluation and a health assessment, and then they're going to develop a conversation around what are the things that are most important to them. There's other staff who are going to assist them with meeting individuals from our Men's Health Referral Network. That's a team of individuals, organizations, health organizations, as well as social service centers that work with us monthly and identify what are the biggest health concerns of men in the city of Milwaukee, and then problem solve. Talk about activities that are related to improving the concerns that the men are bringing to our attention. The other part that makes us unique, we have a child development service that allows men to come into our operation, and if the men are fathers of children 2 months old to 6 years old, we are screening those children in their physical development as well as their social skills. We have child development screening around their motor skills, gross motor and fine motor skills. And there's referrals given in those areas. And it's a wonderful way of showing how systems can work together, not just with the men, not just with their children, but seeing how they can work together with the community and the family.
Great. Can you share with us some of the success stories from your program?
Yes. With the men, we have had situations where there's been gentlemen who've attended our education sessions, identified themselves as people not having access to a healthcare provider. They didn't have health insurance. In some cases, they might have had a particular health concern that had been unaddressed for years. And in numerous situations, we've been able to identify organizations or individuals or services that could directly address them. We've had individuals who were able to get their oral health improved by attending education sessions around oral hygiene and also seeking services from one of our community partners who assisted them with free dental services and also eye care, where they were able to access glasses from a national program. So we're very proud to say that in some cases their health has been improved. In some cases they've been able to seek job services from our consulting partners, and ultimately were trained and educated and then did receive jobs after they went through a job training session. They also have had men who've come through our clinics who have sought individual services for becoming better parents. There are parenting classes, there are fatherhood classes which are available to assist them with that too, and we've been able to make numerous referrals to specific partner agencies that can help them with that.
From my understanding, your program is unique in that there really aren't a whole lot of male-specific health programs at the state and the local level. Could you tell me a little bit about why you think there's a need for that kind of program and what makes your program male-friendly?
We have a need because we recognize that men have a lower life expectancy in general than women, and especially in low-income areas, we see that the patterns of health are demonstrating that the men have the poor nutrition in low-income areas. They have fewer access to health and social services, and there's also lower levels of physical activity. We are seeing many cases where those habits are being perpetuated in the community, and we recognize that much prevention information needs to be shared with the groups. So it's different in a way because we saw a problem, we asked many questions around the problems. We approached men and asked them, well, which problems would you take a look at first and want to either address or have other people address for you? So we're unique in that way. Something else that comes to mind too, we never said that we could solve every problem. We decided that partnership was a direction that we wanted to maintain, and we have worked with our Men's Health Referral Network so that they can introduce the information to the leaders in their organizations and prioritize what's going on with men's health, because if the men's health is improved, then we see that the community health is also improved over time too.
Can you tell me a little bit about how you recruit the clients or participants in your program?
Most of the time we are recruiting through our flyers and our education sessions. So we do have outreach activity, not just at traditional health fairs, but also at other individuals' events. We do speaking engagements, and we have small class as well as individual education sessions. Often we are able to recruit individuals who come into the health department services for other needs. So we have programs where individuals are specifically getting personal needs taken care of through our sexually transmitted disease clinic. Perhaps they're coming as the father or a relative of a client of a WIC program participant. We have a TB clinic which sees men, and some of the men come from those programs. We also have men who come in for immunization, for a variety of immunization activities. This could be for their children or for themselves, and so we have flyers and posters and other methods of advertising to them, and we can get that information to those men. And we try to specifically say to them, it really doesn't matter if you have health insurance or no health insurance. Are you taking care of your health? Do you really understand what we mean when we talk about wellness? And with that particular message, we are recruiting individuals. So walk-ins are accepted. If you're 14 and above, we will take you.
Okay, great. Do you see any trends related to men and their health?
One of the biggest trends is that men are not seeking health activities around their own priorities. Usually someone else tells them, you know, you need to take a look at this, or I noticed that you have this particular problem or concern, or you're showing a cough or you're sneezing and you haven't seen anybody about it. So perhaps a close relative, a significant other, a son or a daughter is telling this person, why don't you get checked? That's what we're seeing as a pattern, and that's where we want it to change. We want men to see themselves as someone who is worth taking care of, not to create all these excuses and say, I'm too busy, or I really know that it's not anything in particular because I've had pain in my life before, I could ignore it. What we also recognize is by the time a person comes in and seeks our help, they may have pain, but the reason they have pain is because something is either exacerbated or something has gone on for a significant length of time, and now they really need to seek one of our referral partners who is going to be able to directly address or treat that problem, because it's beyond the screening and beyond the preliminary level of care.
What do you expect in the future for your men's health program and for the future of men's health programming and advancement nationally?
I expect that, this is my vision, one day men are going to prioritize their health and not see health as an isolated state of sickness or being well. They're going to be able to see that everything that they do is connected to their health. Their financial well-being is connected to their health. Their spiritual self is connected to health. Their mental health is connected to their physical health. Their family dynamic and their community health and their housing status, those things are connected to health. Their employment status is connected to their health. It influences how they interact with other people. And what I really want to see is that men become proactive about explaining to other people, this is why my health is important to me. often we will have today's boys who are going to become tomorrow's men become quiet or reserved or hide their pain because we think that's the manly thing to do. I'd like to see us become a society where we accept that men are people and have the emotions of people and the feelings of people and act on those things and are very proactive about maintaining their health and have a desire to live a long life. And that's the vision that I really want to express not only to our men's health staff, our men's health community and our partners, but also to the individual males.
How do you think other cities could replicate the success that you've had with your men's health program in Milwaukee?
Well, every individual city and community is going to be unique. Milwaukee has its own set of issues that are related to its history, its racial demographic, its income levels. And so people need to first at least study those important factors and find out what are the most pressing concerns with the people in their communities. What they might find is that they have individuals who are addressing these concerns, but they're not working together. So the very first thing that I'd like to offer to people is that the individuals who you are recruiting as your clients, they're really going to be your experts. Even if they don't believe that they're your experts in the field of health, they know something within the context of their family or within the context of their own life circumstances. They know what their community looks like. Allow them to express themselves and find out what are their needs. Then after that, prioritize that information based on what they say are their priorities. So here's an example. If they say that they believe that they would do more physical activity if they would just feel safer in their communities, then maybe safety is what we address versus the physical activity part. Maybe it's a matter of talking to the individuals who could bring more lights into their community at night so that people would feel safer in being outside at night. I mean, those types of things make much more of a difference in the beginning. When people say, my needs are met, they do a lot more follow-up activity.
Can you tell me about some of maybe the one or two top issues that you see clients coming in and expressing their concerns about, or maybe the top things that you and your colleagues work with?
The top issues that we work with clearly are nutrition and diet concerns and physical activity. I am seeing many individuals who aren't very clear on what counts as a fruit or vegetable. And we are seeing numerous individuals time after time when we ask them, what are you drinking? And if it's a non-alcoholic drink, it will be sodas and other things that have high fructose levels. So we're seeing that. It's routine practices such as toothbrushing. Sometimes we're seeing that individuals aren't really clear about the importance of oral hygiene. As far as it goes with physical activity, the lion's share of the men that we're seeing, the adult men, will say that they are physically active, but when you really address, are you really physically active? And they'll tell you, well, I used to play basketball 20 years ago. So we recognize that it's not a regular routine. We also see that the patterns of behavior that are taking place with our younger people, the teenagers and young adults, less physical activity primarily because of more gaming, more social interaction that takes place in a computer or a phone setting versus going out and talking to neighbors or playing with individuals your own age.
and they were thinking about starting a men's health component, a men's health program, what would be the top advice that you would give them?
The top thing that I would tell them to start their men's health program would be find out what the community says about men's health. Do they see men's health as being a completely separate entity than community health? Because if they do, then the first initial step would be incorporate men's health into existing community activities. If the people were saying, well, we see men's health as a unique, special direction where we should take our health priorities, then those are the individuals where we should start talking about programming activities and interviewing the men and finding out specifically what direction are we going to take. Obviously, nothing's going to get done unless we have a clear vision and definition of what men's health means to that community, and then creating a plan so that we can put some action around what steps are going to take place to make sure that these vision statements become a reality.
Okay, thank you.
You're welcome. Good to be here.